So good morning, everybody. Thank you so much for joining us, and a big thank you to Sarah for asking us to come and speak with you all today. And we'll just start off with introducing ourselves, and then we will hopefully be able to share our presentation. The technology will work, and if it's not, we're going to have to wing it. But just to, by way of introduction, so my name is Ros. I'm the service lead here at the Suicide Bereavement Service for Leeds Mind. I've been with Leeds Mind for 5.5 years, but been in this post for a year, and prior to that I was team leader for peer support, so a lot of peer support background for me. And over to Lisa.
And I'm Lisa. I'm the senior post-vention practitioner at the Suicide Bereavement Service here at Leeds Mind, and I've been here for almost 3 years now, next month.
Oh, anniversary coming up.
Yes,
yeah,
anniversary.
Exciting. So before we share our presentation, obviously what we're talking about today can be upsetting. It's I think it's fair to say it's a heavy subject. So it's really important that we look after ourselves. So if people want to turn cameras off, step away, come back in, that's absolutely fine. Just do what you need to do to look after yourselves. But I would stress we won't be talking about detail or method or anything like that. And we will be talking about statistics, and that can feel very clinical, but we very much recognise that behind every statistic is a person who was a friend, a family member, a work colleague. And so, yes, they are numbers, but that's just for the purpose of the presentation. And like I say, we recognise that there's a person behind each and every one of those numbers. And so just important to look after ourselves and recognise that today. So Lisa's going to present, and hopefully this will work. This is always the moment of truth, to see if we can get the technology working. Looking good so far.
Yeah, bear with.
Oh, it's sharing. So is that now full screen for everybody? Lovely. I can see a big thumbs up from Sarah. Lovely. Okay. So what we're going to talk to you about today is a little bit about who we are at the Suicide Bereavement Service, the impact of being bereaved by suicide, how best to support somebody who's been bereaved by suicide. We're going to look at helpful resources, as well as a little bit about self-care and how we look after ourselves when we are working with people who have been bereaved by suicide. And then there'll be opportunities at the end for you to ask questions. So as Sarah's already said, they can go in the chat, or happy for people to unmute and ask us in real life at the end. That would be great. Lovely. Okay, so who are we? So we are a peer support postvention service made up of the Leeds Suicide Bereavement Service. So we cover all of Leeds, and that's been running for 5 years. And we support people living and working in Leeds. So we try to reach as many people as possible. So sometimes we are flexible and we can be a little bit fudgy in that.
Creative.
Thank you. Creative is better than fudgy, isn't it? But, somebody might live outside of Leeds, but they'll have a connection to including the workplace. And so if we can get a Leeds postcode when somebody really needs that support, we will do that. And within Leeds, we're able to support any child of any age, because we have a dedicated family worker for Leeds, so they can work with children on an individual basis, but they can also work with the adults and the children as a unit. But we also sometimes will know that the adult's carer or guardian in that situation might need some sessions themselves as well. So that's a really good added benefit that we've got in Leeds. And then the other part of our service is the West Yorkshire side, and that's been running for 3 years. So that enables us to support adults, again, living and working in Bradford, Calderdale, Craven, Huddersfield and Wakefield. And again, we'll be creative, and you, what we're trying to say, we'll be creative. And if it's somebody outside of those areas, but they've got a connection to, and they've been bereaved or impacted by a suicide, we will work with them. And then we're really lucky in that in Kirklees, we again have a dedicated family worker, and we'll do exactly what we do in Leeds with that worker, in that they can support children, carers, parents and guardians as individuals or as a unit or a combination of the two. So What we provide mainly is emotional and practical support for people who have been bereaved or affected by suicide. So it could be somebody who's lost a family member, a friend, a work colleague, or it could be somebody who has been a witness to a death by suicide. So we very much will be, we're governed by what an individual tells us. If they're saying that they've been impacted by a suicide, we can work with them. And we are a postvention service, and by that we mean we offer planned interventions with people bereaved or affected by a suicide after the event has happened, as opposed to prevention where we're working with somebody beforehand. And what makes our service, I think, different and special is that we're a peer support service. So everybody in the service, apart from myself, have been bereaved by suicide in some way themselves. So like I say, not me, but including our admin and all the practitioners. So you're speaking to somebody who gets it because they have some level of experience themselves. And please bear with me, I'm going to have a drink because of the inevitable dry mouth is setting. And it always feels like taking a drink takes a very long time as well. Okay, so our aim, so as a service, we want to be able to support people through their grieving and or adjustment process and ultimately limit risk of further suicide deaths. Because what we do know is if you have been directly bereaved by suicide, your risk of suicide increases. And so yes, we're postvention, but we're also preventative because we're working with people with an increased risk to reduce further deaths by suicide. And we offer support no matter that relationship. So as I've already mentioned, it could be a witness, a friend, a parent, a grandparent. And also the time since the death is kind of immaterial. So it could be 2 days, 2 weeks, 2 months, 2 years, 20 years. Again, if somebody's saying to us they've been affected by a suicide in any way, any time, we will work with them. And as I already mentioned, but just to kind of reiterate, we offer support for individuals, families, and we also offer support in the workplaces. A lot of the support is through one-to-one sessions and then peer group sessions. And we also hold workshops, we offer training, and we host events like memorials. So Lisa, do you want to just really quickly talk about memorials because it is your expertise?
Yeah, so in December, usually we have a couple of memorials in different areas across West Yorkshire, and we usually are remembering loved ones, lighting candles, having a little service. So the celebrants on the call, I used to be a celebrant. I was a celebrant for 5 years, so I use some of that experience to create a nice little service where we can remember loved ones, and also just for people to come together and see that they're not on their own. You know, there are other people who are out there grieving and, you know, want to share that same experience. So memorials are always really nice and really well attended.
Thank you very much. And just to go back, so when we're talking about one-to-one sessions, so we offer individuals and families up to 6 sessions. Now, most people will take the full 6 sessions, but on occasion, some people may have 3 or 4 and then advise us that they don't need any further support. It's person-centred and it's holistic, so we don't go into the sessions with any set agenda about what we need to achieve. We're led by what the client wants. For some people, that will be being heard and listened to. Other people, it will be that and a combination of practical support, including things around inquests, but we are very much person-centred, client-led. And workplace support is slightly different. So we may, an example would be, there was sadly a death by suicide of a student at Leeds at uni. We went in and supported that workplace, and they can be one-off facilitated conversations with staff to give them the space and the time to talk through how that death has impacted on them, and just giving them that space and support as a team to talk to somebody who gets it in a safe space, free of judgment, away from management and all those complications that can come when people are affected in the workplace. Okay, so the impact of suicide. That's me. Pass over to my lovely colleague.
So again, just a reminder that I'm going to be talking about statistics, but we do recognise that there are real people, real families behind these numbers. So helpfully, there's a great big bar across the number, so just bear with me a second. So this number here, 5,583, this is the number of registered deaths by suicide in England and Wales in 2021. They are the latest statistics, so you can see there is a bit of a lag, and also with that year, obviously it was COVID, so there were delays with inquests and things, so it is the official number that we've got, but obviously it comes with the caveat that there was other things going on at the time. So that's the number across England and Wales. Now in our area, Yorkshire and Humber, of those 5,000 and odd, 589 is the number of recorded deaths for just our area alone. This number, I don't know if anyone is familiar, maybe some of the councillors will be, but 135 is the number of people significantly impacted by one death by suicide, according to some research by Sorrell et al. So I did some quick maths and multiplied the number of deaths in Yorkshire and Humber with that 135, and that sadly comes to this number. So nearly 80,000 people would be the estimated number impacted by a suicide in Yorkshire and Humber alone, just in 2021 alone. So you can see that ripple effect of each suicide is massive. So each of those people who have been impacted by a suicide may be experiencing some of these. So feelings of guilt, isolation, shame, confusion, anxiety, rejection, often lots of anger, but that can be directed at different people and places. So it might be at themselves, it might be at the person who's died. Sometimes it's at services like, police, prisons, hospitals and things. There will be lots of unanswered questions that they're experiencing. I know for myself, when my friend died by suicide, I would often think, what if I just texted one more time, or if I rung instead of texting, or, why didn't he mention anything to anyone? So lots of unanswered questions. They might be experiencing feelings of embarrassment. They may be feeling panic and worry, a feeling of overwhelming sadness, abandonment, especially if that's a child that's lost a parent to suicide. They might be experiencing a preoccupation with death or danger, maybe feeling some blame there, some self-blame, experiencing shock and feeling responsible for the death. On top of all of those things, there may be some physical reactions, normal reactions, but the kind of physical symptoms, if you like, of grief. So things like sleep disturbance and nightmares, fatigue and exhaustion, nausea, sore muscles and joints, flashbacks, digestive issues and headaches. They might have skin problems. They might feel tearful all the time. They might be experiencing cold sweats and chest pains. And because of all that, that might lead to feeling a lack of motivation to do anything. They might feel that they're unable to concentrate or to keep on top of tasks at work or even at home. And then on top of all of that, they may also be experiencing stigma from their family or their community. They might be experiencing trauma. So we know that previous research has shown that people bereaved by suicide are the most likely group of bereaved people to experience post-traumatic stress disorder. They may be having to deal with press and media attention. And then they also have to navigate the inquest process, which can be lengthy and overwhelming and complicated. So with all of that, obviously, it's no surprise that people who are impacted by a suicide are more likely to experience what's termed as serious social adverse consequences. So things like relationship breakdowns, unemployment, financial worries. They are more likely to engage in high-risk behaviours such as problem gambling, self-neglect and drug and alcohol misuse. They are more likely to experience suicidal ideation themselves, and they are more likely to attempt suicide and die by suicide. So how can we support people bereaved or impacted by suicide? It's not all doom and gloom. we can support people. The first thing is obviously acknowledging the loss and avoiding those cliches like they're at peace now, their pain has ended and things like that. You know, listen, I'm sure you all do this anyway, you know, providing that space to listen without being judgmental, you know, just offering that reassurance. Making sure that you're offering a person-centered approach. So what is it that they need as a person, and asking them directly, are they experiencing suicidal thoughts? Do they need a hand with childcare that evening? You know, if you're asking for a friend, you know, what is it that they need? And then sometimes just taking that one job from their to-do list is a massive help, whether that's, you know, getting in some bread and milk or calling a GP or something, but always making sure that it is what they need. It's really important that we consider the wider picture. So what else are they dealing with? Like we said, you know, a lot of people bereaved by suicide have relationship issues, financial issues. So what else are they dealing with? Are there any children involved? Any other family members? And are they having suicidal thoughts and ideation? It's really important that there's flexibility in that support. So like we said, you know, people are feeling it's difficult to keep on top of things, difficult to keep organised. So you know, it might be that a particular time or day of an appointment is better than others. So just having some flexibility in that support. And also being mindful of anniversaries. A lot of the time when we're bereaved by suicide, we kind of, how am I going to explain this? So it might be that someone died, say, on the 4th of November. So every 4th of a month might be difficult. It's not just, you know, 6 months, or it might be every Sunday is difficult, or, you know, every evening is, you know, because they died on an evening. So just being aware of what that person's triggers are around anniversaries and significant dates. And also flexibility around the inquest, because inquests can take quite a long time. And the impact of the suicide might be after the inquest, so that people tend to go back to work and feel okay. And then actually it's after the inquest that people then start to find things even more tougher, even more tough. You know what I mean?
We knew, yeah.
So in summary, what we're saying is that even though people, you know, professionals, friends are providing short-term support, that actually it is a long-term impact, and it's really important. So if you are showing that you understand the impact of a suicide bereavement, you are recognising that there has been those changes in relationships, that they might be finding things tough and fatigued and all of those things, that you understand. If you're being mindful of those triggers, things like significant dates and language. If you're encouraging those symbolic actions, so that might be, you know, visiting a grave, it might be journaling, it might be sharing pictures. If you're encouraging that continuing bond with a loved one, and you're signposting to local services or national helpline numbers, that's all really short-term support that you're offering. But the long-term impact of that is that people will feel listened to and understood, because you're normalising their feelings, and that's really important. You're reducing the potential for them to be re-traumatised, and you're reducing the risk factor of them dying by suicide themselves. They'll know that you are a safe space to speak openly in future. So it might be, you know, the anniversary a year down the line, they'll know that you are a safe space. Oh, sorry, I thought there was another line after that. So yeah, so it's just that that short-term support is really important because it just has that long-term impact for people.
Lovely, thank you very much. So I'm going to talk to you now about resources and further reading. So what we haven't said is we can share these at the end of today, so we can share probably the slides and further information with Sarah, so you can look this up further. But I think it's useful to know what's out there. Some of you probably already have some of this anyway. But one book that we give out a standard, which is really helpful, is The Help Is at Hand. And it's useful but it's helpful with help in its title. But it's a booklet by Public Health England and the National Suicide Prevention Association, and it's really a comprehensive guide to where to get support and what resources are available, I think both for people who have been bereaved by suicide, but as a practitioner or anybody supporting people. So if you haven't got it, it's definitely worth getting. And
Can I just interject there? Sorry. You can download it as a PDF, but you can also order it for free from public health resources. So if you need a hard copy as well.
Yeah, lovely. Feel free to interject any time. No, you're okay. Then there's Finding the Words. So it's a booklet by Support After Suicide Partnership on how to have difficult conversations. Because often what people do is worry about having that difficult conversation around suicide and being bereaved by suicide, and then the conversations don't happen. That further makes, that can further add to people feeling misunderstood and isolated. And so conversations don't happen and support isn't then useful or found for the people who need it. So it's a really good guide to what language to use, what to avoid, and kind of just helps people to get over that initial barrier of, I'm going to say the wrong thing, or I'm going to say something that makes the whole situation worse. So that's a really useful tool. Probably a lot of you on the call do have those difficult conversations, and it might be more for friends and family who are perhaps supporting somebody for the first time who's been bereaved. Then From Grief to Hope. So this is a research report, and it was published in 2020, and I think it's probably one of the first where the report really listens to the voices of survivors of suicide loss. And I've got to say, I think Finding the Words and definitely From Grief to Hope are available online to download out there. And I think what makes From Grief to Hope slightly different is that lived experience voice. So it's people talking from their own experience, what's helped them, what doesn't help. And it can really inform our work as practitioners to make sure that the support that we're providing is appropriate and is what people telling us that they need. Then we've got the Inquest Handbook, so by Inquest, so it's a specialist advice service regarding what to expect and including the rights of the bereaved. So as Lisa's kind of alluded to a couple of times already, inquests are an absolute minefield for people to navigate. They're open to the public, people to often know that. If you've never been through an inquest before, how would anybody know what to expect? Our staff often have experience and so can support people through that, but it's a very specific process to go through. So the handbook really breaks it down for people, just breaks down a little bit about fear, so people have a little bit of an insight into what to expect and they're not going into that situation blind. So again, if you're supporting anybody who may be going through an inquest, it's definitely worth looking at if you haven't already. And then finally, the Samaritan's Media Guidelines. So this can be really useful for organisations and practitioners to use to inform your own understanding of the impact of local media, or what to do when you spot unhelpful or potentially damaging coverage. And that's very diplomatic, because actually sometimes we see some really shocking reporting in the media, and what we've got to kind of remember is that is that's not just a person, is it? It's a person who's got friends and family, and the impact of really kind of shoddy and inappropriate and thoughtless media reporting, which sadly does happen quite a lot.
Like drone coverage and things we've seen.
Yeah,
horrendous.
Yeah, and mentioning method where, you know, like location and method, sharing unnecessary details about the individual who has died. So there's lots of different ways in which poor media can have a real impact on friends, family, you know, those 135 people, you know, impacted by that loss. So the Samaritans offer really good guidance as to how you can challenge. So we as an organisation, we both regularly keep an eye on local media. If we see an article that's inappropriate, we will use the Samaritans guidelines and send a you know, diplomatic but snotty email to say, this is, you know, this is what we've noticed, this is why it's not really acceptable, and we guide them towards the Samaritans guidelines. But it's just really useful to know, because if you do see something and you feel quite strongly that you want to do something about it, it helps you to be able to do that.
That breaks down some of that stigma as well, to just say, even if it's just asking, you know, a BBC report to add a helpline at the end of their article, instead of just, you know, throwing out there that something's happened. Yeah, that could be really helpful.
Because we have tried to undertake a piece of work with our comms officer working with press organisations in Leeds to ensure that those helplines and contact details are at the bottom. And it's not necessarily about, oh, you've got to promote our service, but it's about the wider support network that people need, and those wider national numbers that people can contact if they're really triggered or impacted by the media reporting deaths by suicide. Okay, so I think before we move on to self-care, a couple of things that are really important to remember is that we as practitioners or as friends and family supporting people bereaved by suicide, we're not immune to vicarious trauma or compassion or empathy fatigue, and we may need support ourselves as professionals. So we're not robots, we're humans. Listening to this, you know, listening to people's experiences and dealing with suicide day in, day out can have an impact on our own mental health and our well-being. So I think a lot of you will know this already, but when we're talking about vicarious trauma, what we're referring to is the trauma that we as practitioners or friends and family may experience when being directly exposed to a traumatic event. So listening and hearing people talk about their trauma can then have a little bit of a trickle effect onto us as well. And it's really important to always acknowledge that each individual may experience the effects of any trauma, but in this instance, vicarious trauma differently. So it can be that somebody might then become very emotional and teary, but it might be that then somebody becomes quite withdrawn and is giving off an appearance as if they don't care, and they do. It's just their way of dealing with hearing a lot of trauma from people. So it's just important to be aware of. And when we're talking about compassion and empathy fatigue, so that's really the emotional and physical exhaustion leading to a diminished ability to empathise or feel compassion for others. So compassion fatigue is the strain of feeling of another's pain. So again, just really important to remember, because we're not robots, this could happen to us. So that leads quite nicely on then to self-care. And when we're talking about self-care, I'm going to give a lovely example. As Lisa, we were talking about this yesterday, and Lisa was like, I think it's really important to remember that self-care is not just about having a nice bubble bath, which of course having a nice bubble bath can be part of somebody's self-care routine. But when we're talking about self-care, we're not talking about it all being about the individual. And I think the wellbeing movement at the moment has become, we're all individuals, we're all our little own islands, and to look after ourselves you need to go off and look after yourself, and there's nobody else has any responsibility for that. And I think, yes, we have to take responsibility for looking after ourselves, but that can be really difficult, and sometimes we do need to seek professional support, or we need to speak to friends and family. There's lots of different ways in which we can look after ourselves, and we're not talking about self-care just in that kind of isolatory, is that a word? It is now. Yeah. We're not talking about self-care in isolation of one person just doing things for themselves, but that wider systemic understanding of how we look after ourselves and what that means for us as individuals within a society, but as individuals as well. So many individuals in that sentence as well.
They were, yeah.
So we thought it would be really helpful to look at the types of self-care that everyone I don't know if should is the right word, but would be would be helpful to be aware of. So physical, so it is those things like sleep, stretching, moving around, exercise, walking, diet, yoga, and rest. And I think sometimes we underestimate the fact that we need to rest as well as do all those other things that the body requires. Then there's the emotional aspect. So we're talking about emotional intelligence, managing stress. So we use the stress bucket at Leeds Minds. That's always a really easy place to start off if you're wanting to look at stress management. Other models available, obviously it's just the one that we like. Emotional maturity, forgiveness, kindness and reflection, also for ourselves and for others. Social, so being able to connect with friends and family, having a support system around us, however that looks, because it is going to look different for everybody. Having safe boundaries again with friends, family and those support systems. We talked about the media, but trying to engage in positive media and limiting other forms of media that might have more of a negative impact on our mental health, or maybe reducing how often we're looking at the news and things like that. Communication, so being able to communicate how we are feeling. Again, some of these things are easier said than done. It can be difficult to communicate, but maybe having that one person or that support system where you are able to have a chat about how you're feeling, and then asking for help when that's needed, whether that's from a friend of family, a work colleague, helpline, yeah, phone lines, going to the GP, talking therapies, however that may look. And then for some people, for not everybody, spirituality is quite important, and that again can mean different things for different people. For some people that's time alone. I'm definitely one of those people, definitely like time to myself, but enjoying nature, connecting to nature. For some people that would be meditation or keeping a diary, yoga again, music. I went to a gig last night, so music can be really important. But then also the personal element of self-care is knowing ourselves and knowing what works for us. You know, I tried meditation for years and realised way down the line that actually that doesn't work for me, that's fine, and it works for other people. So it's knowing what kind of form of care is going to be beneficial and not going to add additional stress to ourselves. Again, some of these might be aspirational, so loving your true self sounds probably aspirational for a lot of people, easier said than done, but again, just trying to have that compassion and that care for ourselves that we give to other people, and being secure if possible in our personal identity and engaging in hobbies. We're talking about space, so the space around us and the world that we navigate being a healthy environment, it being secure and stable, surrounding ourselves where we can with people who we find to be positive, and that overall sense of safety. And then there's also a financial element of self-care. So again, we know that not all these are easy, but it's just being mindful of savings, budgets, splurging where we're able to, and then sharing where we're able to and want to, I guess. And then finally, self-care within the workplace. So where possible, hopefully having a positive workplace, that work-life balance, time management, being able to learn, take breaks, engage in a role that we find productive and rewarding. So I won't go into the other one because it kind of overlapped, but we will send these out and you can look at them further. And then just a little question in the middle for you to think about is, how will you take care of yourself today? Will you log off after this and have a nice Starbucks, or go for a walk, take the dog out, listen to a nice piece of music? Just have a think about a little immediate thing that you can do afterwards to look after yourself. And then, oh, I missed a little slide there. And then now we're to our Q&A. So thank you very much for listening.